With more on where we stand right now with the threat of the coronavirus and all of the changes, joined now by Dr. Maja Artandi with Stanford Health Care. Thanks for joining us today. Let's get started right off the bat with these variants, because just when you think you have something beginning to get under control, they're changing. The more prevalent one appears to be this UK variant. What do we need to know about it?
Yeah, good morning. Let me start with explaining what variants are and why we care. So if you picture the coronavirus, it has about 30,000 letters of genetic information called RNA. And with this genetic information, the virus gets to do what it needs to do, attach to human cells and replicate. Now, when the virus forces the human cell to replicate, sometimes the human cells makes copying errors, and those are called mutation. A cluster of virus that has the same mutation is called a variant. Currently, the British variant, it's also called B.1.1.7, is really starting to spread very rapidly in the United States. The variant of the British strain really targets the spike protein, and that makes it more contagious and potentially also, unfortunately, more lethal. The study that you mentioned looked at how fast this variant spreads in the United States. Many researchers came together and looked at hundreds of thousands of coronavirus tests, and they came to the conclusion that cases that are infected with this new variant double about every 10 days. And that means that by the end of March, this variant will be the predominant variant in the US. Now, why do we care? And I said before, this variant is probably more contagious and more lethal. So that means that we might have another surge ahead of us in hospitalizations and in mortality. What can we do? So unfortunately, we have to continue to social distance and mask and hand wash. But the good news is that the vaccines actually work really well against this variant. So if you can get a vaccine, please get a vaccine, because it's going to be very, very helpful.
Okay, that I think has been a lot of people's concern. Does it work? Because I've heard a lot of conjecture that we think it's going to work against this variant. Is the data looking pretty solid on that right now?
Yeah, against the British variant, the data is looking pretty good.
Okay, and what about the South African variant? We've had 2 cases here confirmed in the Bay Area. There are probably many more. What level of concern should we have about that?
So those are a bit more concerning. So currently there are 3 variants of concern, actually. The British variant that I already mentioned, and then we have the South African variant called B.1.351, and then we have a Brazilian variant called P.1. And the British variant, as I said, is more contagious. The South African and the Brazilian variant are actually scary because they can evade the immune system. So even if you had an infection with the old SARS-CoV-2, you can get another infection with the South African or the Brazilian variant because it can evade the immune system. Again, those mutations target the spike protein. Antibodies bind to the spike protein cannot bind as tightly, and so it evades the immune system. And what we also found out that the vaccines are not as effective against the South African and the Brazilian variant. Doesn't mean that they don't work at all, but they don't work as well.
Okay, when it comes to people who have gotten the vaccine, been lucky enough to do so, I just want to break down what level of protection we have at this point. If I can throw out a couple of scenarios, say, I have not gotten the vaccine, but my elderly mother has. Can I go and visit her?
If you social distance and wear a mask, you can. We know that the vaccines will protect people from getting really sick. So the vaccine works great against severe disease and hospitalizations. There are potentially still mild cases of COVID-19, even you got the vaccine. And so we don't tell people, hey, because you got the vaccine, you can just go on with your life. You still have to be careful.
Even if both people have gotten the vaccine?
Even if both people have the vaccine. In my clinic, we're all vaccinated and we still social distance. Everybody still wears a mask. So until we have the green light that we know everything works, remember the vaccines are really new. I mean, they started the phase 3 trial in July 2020. So it's been like half a year. And so we still learn a lot of new things about the vaccines.
The newness of the vaccine does still give people pause. And we've heard a lot of people getting a more extreme reaction for the second vaccine. Is that something you experienced? And should people be concerned about that?
I am the medical director of the COVID clinic at Stanford. And I have to say, getting COVID is so much worse than a vaccine reaction. So please, everybody, get the vaccine. The vaccine reaction is expected because your immune system is learning how to deal with a virus. So then it can protect you efficiently and effectively against the virus. Vaccine reactions are real, especially after the second shot. But again, I mean, you can expect being maybe in bed with some chills or fever for a couple of days, but so much better than getting COVID.
And if you are sick, that's a good thing. It's hard to believe, but it's a good thing because it means your immune system is actually reacting to this.
Yes, that's what we think. If you have a reaction, your immune system is reacting to the vaccine.
Okay. What about people who have already been infected with COVID-19? They're still recommended to get the vaccine, but now we're hearing maybe only one dose. Where do we stand with that?
So unfortunately, we still have a little bit of a vaccine shortage. It's ramping up, but right now, not everybody who wants the vaccine can get it. And so people think, so how can we save vaccine doses? And one idea was, if you got COVID, maybe you don't need both doses. And there are actually two small studies that looked at that. The researchers included people who had COVID before, and they proved that by testing their antibodies. And then they gave them the vaccine, and they looked at A, side effects, and B, antibody response. And they found that the people who had COVID before had more side effects after the first dose. Typically, we have side effects more commonly after the second dose after the COVID vaccine. And they also had a huge antibody response. And so they concluded, well, if you had COVID, you only need one dose. Many immunologists don't agree with that, though. And why is that? So the trials to approve the vaccines were done with tens of thousands of people, and everybody got 2 doses. So that's the best data we have. Also, it's really hard to prove who had COVID, who had not. So you need to get an antibody test on everybody. And then how about people who didn't have severe COVID? Typically, they have lower antibody response. So should they get 2 doses or 1 dose? So it's very unclear. The good news is if you had COVID and you get 2 doses, that will not hurt you. So it's not dangerous. So I still recommend it to get 2 doses for everybody.
Okay. Let's talk about the return to school. A lot of districts trying to do that right now. And the latest recommendation is that teachers don't necessarily need to be vaccinated. What do you think about that? Is it a good idea to send teachers back into these classrooms without vaccinations?
That is such an emotionally charged topic. So on the one hand, we have the teachers represented by the teacher union who really care about their students, but of course, also worried about their own health. They're worried about being exposed and get infected with SARS-CoV-2. On the other hand, we have the state and the national government, and they say let's open schools immediately before everybody gets vaccinated. And actually, the American Academy of Pediatrics supports that and sent out a statement that they also agree that schools should immediately reopen because the harm of keeping kids home outweighs the risk of reopening. And then in the middle, you have the parents and the kids who are kind of caught in this dispute. And I have kids myself who do virtual schooling, and I can see how hard it is. I mean, being an adult and being on Zoom meetings all day, exhausting. And then for kids being in school, virtual school, it's really hard. Fortunately, my kids are not in elementary school anymore, so they don't need my active support to be there. But there are many parents who have to actively support their kids while they're in virtual school. Also, I'm very lucky because all my kids have computers and we have internet connection, but many children are not as privileged and they can't even do virtual school. So they are academically left behind. And so there are tons of harms of virtual schooling. Now let's look at the risk of going back to school. And there's actually really good evidence that it is not as dangerous as we think. There was one study that looked at 100,000 students, faculty, and staff of in-person schooling over a period of 9 weeks. And during those 9 weeks, only 32 students got COVID-19. And that was because they didn't socially distance, they ate together. No kids infected any of the adults. So looking at that, I think it's safe. It's a good idea to reopen schools. Of course, we have to prioritize social distancing, hand washing, mask wearing. Some schools actually have a great idea. They do weekly classroom pool testing, and that also keeps teachers and students safe.
Okay. So you're feeling confident about the plan at this point.
I do.
I always have to add at this point at the end, because we know things are changing so much, but you always stay on top of it for us. Dr. Maja Artandi with Stanford Health Care. Thanks so much.
Always good to see you.